guys, I hope everybody is doing well. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're discussing knee pain after squatting. A lot of people experience knee pain at the gym when they're doing lunges or squats. Sometimes it's immediately after, sometimes it's a couple days after, but a lot of times squats are the reason that people complain of knee pain. So if you're getting it during, obviously we know the exact cause. If you're getting it after, it's a little bit trickier to diagnose, but super important, and we're going to show you all the ways that people do squats with improper form, and it's really important that you watch and understand because it is absolutely a link to knee pain. So understanding what you should not do is really important when you're squatting. Squatting is a great form of exercise. Everyone should do it. So is lunges, but you do have to be careful because so many people are quick to add weight. They want the bar on the back, they want the dumbbells, and really most people can't even do 30 quality squats without weight. So there's no need to add weight until you really have probably about 3 sets of 15 where you are going down and up with no issues. Now, when I say down and up, you really should be squatting to the floor. This is not really a great squat. You want to make sure that you're going past 90 degrees because you want to get that glute activation. If you're only here, you're not really working your glutes. In order for that glute medius to become involved, you've got to go beyond that 90 degrees. So I understand when you have a bar on your back, it's a little bit more difficult. So you do want to make sure that you're being safe. But that's why I say so many people have difficulties doing this a full squat. If you're able to do a single leg squat to the ground, more power to you. That's one of the best exercises you can do. And that's really what everybody should work their way up to. But you got to be able to do body weight squats to the ground with both legs before you do single leg. So let's talk about some of the issues on why you have knee pain when you are squatting, after you're squatting, even lunges kind of follow the same pattern. So what happens is a lot of times you may have one of these things going on, you may have a number of these things going on, just kind of pay attention. You always want to squat in front of a mirror, and you want to watch as you squat that your knees are not coming in. Now, this is a really gross exaggeration of what happens as the knees come in, but it is very important because a lot of times it's so subtle that those knees are tracking inward. But as the knees track inward, it is going to cause you knee pain. It's going to cause stress on the knee. So really watch as you squat down that you're not doing this. It's going to be a subtle movement for most people, but you're going to see them shift inward. How can you correct this? A lot of times people like to wear a band around their legs so it forces them to push their knees out. That's not the end-all be-all fix. You should be doing some other exercises, and we do have some knee strengthening exercises, knee pain strengthening exercises. If you look at our YouTube channel, Total Performance Physical Therapy, we're going to show you those exercises. I'm not going to go through them now. But you want to make sure that you're strengthening your glutes and your core in order to be able to hold your legs out. One of the biggest problems with squats is, especially as you get stronger, is that you are able to do these minute changes, these minute compensations that are very tough to find. But if you're getting knee pain, it's definitely one of the reasons. So first one is watch that knee tracking as you go in. Your knees should stay right over your toes. Okay, another reason for knee pain is that you are bringing your knees in front of your toes. So you're squatting like this, all right? Anytime you go to squat, really the first move should be the butt goes back like you're sitting in a chair. That's really important. If you squat like this, that's going to cause that knee pain. That's causing that pressure going forward onto the knee. Another cause of knee pain along those lines is the heels coming up. So a lot of people, when they squat to the ground, they start to lift their heels in order to be able to get all the way to the ground. That's causing knee pain. When you're squatting to the ground, you're sitting back and going down. You're not squatting just to get to the ground so your heels pop up. Your heels have to stay flat on the ground. If you are squatting all the way to the ground, the idea is that your heels stay flat. Otherwise, you can cause yourself knee pain. Squatting with knee pain or having it cause knee pain also is because of this type of range of motion where a lot of people just do this and then they start to load their back, they load their knees. And really doing a squat where you're here and you don't have the strength to go all the way down to the floor and come back up is not good. You really are strong from here to here, and that's about it. That's not a very big range of motion that your legs can move in. So make sure that, especially if you're experiencing knee pain, that you're able to get a full range of motion squat like several times before you're loading your back. Otherwise, you're just loading it here and your knees are going to get really sore because there's no hip support. There's no core support. There's nothing stabilizing those knees. So you really want to be careful of that. Another reason for knee problems when squatting is footwear. So it's not often thought about how your feet are reacting when you squat, but it plays a big part in it. So if you have a flat foot or even a high arch foot, you have to be careful. For myself, I'm very flat-footed. So as I stand normally, my knees are a little bit turned in. My foot is flat, so everything naturally is going in. So my foot needs to be in the proper shoe in order for my arch not to collapse and my knees to go in. Again, these are all little compensations that are going to be very tough to find. I recommend you videotaping yourself and watching yourself slowly, or having a partner who's good at it. Another thing that I see a lot of when we are squatting and you get knee pain is someone will go down and right at the bottom they'll do a twist to come back up. The twist is not that big. It's going to be very slight and you can barely see it. But it is a very big cause in knee pain. I actually just hurt my knee doing that. It actually made my knee sore. So it is very important that you understand this is not, you're not going to see somebody go down and then twist. I mean, you might, and obviously that's easy to see. But it's a very small twist right at the bottom to compensate for some weak glutes and some weak hamstrings to get back up. So the minuscule things you're looking for are not going to hit you right over the head. It is hard sometimes to get these things, or to discover these things. You really have to kind of take a close eye, even videotape yourself nice and slow. But those are really a lot of the reasons why people have knee pain with squatting. Those are the most of the compensations that we see when somebody comes in and says, hey, I can't squat, my knees are hurting me. If your knees are hurting you during squatting, you really want to back up and kind of take it slow. Go back to the body weight squats. The one thing I see, the correction I see that is completely wrong when you're doing squats is the ball behind the back. If you're doing that for more of a back stabilization, totally fine. If you're doing that because you have knee pain, you are causing yourself actually more knee pain because the ball is pushing you forward and it's forcing your quads to work harder, which just means it's pulling harder up front, which means it is putting more pressure on your kneecap. So don't grab a ball and squat against the wall thinking that's going to solve anything. Make sure that the best type of squat is a body weight squat where you're just standing there. Go all the way down to the floor. It's okay to have your toes spread out a little bit. It's really hard to go flat to the floor just like this. So you can turn your toes out, your hips stay wide, you're up here and you're just going all the way down and then coming all the way back up nice and easy. Once you can do about 15 of those 3 times through, then let's talk about adding weight. But even before you add weight, I'd go to the single leg squat. And I would start doing a single leg squat to the ground and come back up. And then on each leg, until you're able to do it on each leg for about 15 times 3 sets, you don't advance to the next one, which is then adding weight. So there's a couple of progressions that you should be going through when you're talking about squatting in order to prevent that knee pain from coming on. If you or someone you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.